So, to the announcement today of what we'll be doing in the state of California, we are going to, just as we did back in March, we started with a full stay at home order. It was very effective. Californians came together. We were able to stay ahead of our curve and keep transmission low. Today, in a more focused way, based on many things that we've learned over the past many months, I'll go over those things in just a moment. We are putting forward a limited stay-at-home order, one that is more targeted, one that is more focused in the following ways. It impacts counties that are in the purple tier. You'll remember on Monday, we announced 41 counties across California are in the purple tier. Today, we are not announcing additional counties in the purple tier. In fact, over the past 48 hours, if we looked at the data, no county across California has moved to a more restrictive tier, and certainly no one has moved to a less restrictive tier. We're asking that as part of this targeted, limited stay-at-home order, that people are home by 10 and stay home until 5 a.m. This means that many essential businesses that we've in the past called non-essential businesses. There's a list of what's included and not included in that category, that we ask that they close operations by 10 p.m., that people can get home by then, and that they stay home, and those businesses don't resume operations till at least 5 a.m. throughout all of the purple counties. This order, this public health order that will be modified at the state level, will be effective November 21st, so that's Saturday night at 10 p.m., and will go until December 21st at 5 a.m. So what does this mean practically? I'm sure many are asking what this means. I just wanted to highlight a few things at the top. I know I'll get many questions on this and look forward to answering those. But what does it mean that you can still do? So I think about my own life and often the need with 4 young kids to make a late grocery store run to make sure we're stocked for breakfast in the morning or a meal. And yes, it does mean that I could still go to the grocery store at 11 if that grocery store is still open to pick up milk or eggs or whatever I need. My dog doesn't walk very well, hard to get around the block. But yes, I can walk my dog at 11 p.m. if that's your tradition and routine. And for restaurants that close their front door at 10, doesn't mean that the back door to do takeout and delivery is closed. And so we urge people in a limited way to use restaurants in that way. And for all you restaurant operators and owners, that's certainly an opportunity to keep some amount of business going. And why are we doing this, and what are we hoping to gain? It's really to avoid further restrictions. We know, and we've seen in the past, that COVID goes from 0 to 60 miles per hour very quickly. That we're in a place today, but that can rapidly change. Maybe not statewide, maybe just in a handful of counties, but further restrictions is what we hope to avoid. But all tools are on the table. We have sort of that top shelf of the toolbox. We continue to use those tools, but on that bottom shelf, if necessary, we will explore further restrictions. But we hope today's actions, our collective coming together, our resolve to keep our protective behaviors up, will help us stem the tide and bring these surging numbers down very, very soon. Again, some reminders of why we're doing this today. Why now? Well, we want to keep the highest risk individuals safe. We know that although many people who might be out and about, even between 10 and 5 are not the most vulnerable, not our oldest Californians, not those with underlying chronic conditions. That said, we know that those who are out, who might be engaging in higher risk behaviors, that those infections can quickly spread to other settings. Maybe you're a worker who's out at night with a group of friends, outdoors even, and you contract COVID, and then you go the next day to work and it is passed on, maybe not the next day, but a day or two later, to a vulnerable resident in a congregate care facility. Exactly the situation we want to avoid. We've learned very clearly that it's not just about our own personal COVID risk, but it's about the risk that we infer on others around us because of our choices and behaviors and actions. This is, of course, to keep essential workers safe as well. Those who continue to pick our food, sell our food, prepare our food, and many other essential workers across the state, allowing them to come to work with confidence and safety, part of the reason why we do this today. We continue and haven't over the last week or two, but it's always front of my mind, the disproportionate impact of COVID. And as we see cases surge, that disproportionate impact still holds. We will see brown and Black communities across our state disproportionately impacted, more Latinos, more African Americans, more of our Asian neighbors infected because of some of those conditions of work and other situations. And we want to make sure we do all we can to support and protect those populations. And frankly, this is going to help us stop the surge faster and avoid more severe actions and restrictions, as we've talked about. And ever so important to remind you that our hospital capacity, although we did a tremendous job preparing and have those resources in place, some have been activated, many wait to be activated, but we want to make sure we protect that hospital capacity so those who need care get it and get it in a timely way and in a way that's high quality so they get all of the benefits that they can. So California, as we've reminded before, we were the first state to do a stay-at-home order. We saw its impact back in March, those difficult days adjusting to the reality of COVID, but that kept us ahead of the curve. While other states were experiencing high rates of rise and were working on flattening their curve and their transmission, we really didn't in March experience that radical rise. And just like then, today's actions will help us bring down transmission and flatten our curve, this time in a very important and urgent way. This graph, we haven't shared it in many months, but we showed you back in March that without an intervention, we see these rapid rises. And yes, it comes down, but after a really important toll on all of Californians, that without interventions, we see high case rates, high impact on our hospitals, but with interventions, with the things that we're emphasizing today, along with the many other actions that are already in place, that we can bring this curve down, we can flatten it, we can get it to a point where our healthcare system is able to do what it's intended to do, which is take care of the sick in a high quality and complete way. I wanted to remind people, because today I've already gotten questions, our own team talked about it. Why are you focused on the time period from 10 to 6? Why are we not doing what we did in March as we have significant concern around surges? Well, we've learned a lot, and we've been a state that has been guided by data, guided by science, and in that data and in that science is a great amount of learning and refining our thinking, focusing on our interventions in a way that allows us to be more targeted and do things not in all tiers, not at statewide, not for 24 hours of every single day, but in more focused ways. And what are some of those lessons? It's that masks do protect us, not only those around you, but the evidence is clear that they protect you as well. Moving things outdoors significantly reduces the risk of exposure and transmission. We've mentioned it already here. We've mentioned it for many months. Move things outside, keeping it short. Both of those things helps us reduce transmission. The whole concept of ventilation, about bringing outdoor airs indoors, even in canopied areas outdoors, making sure that we have clear and easy ventilation is an important feature to reduce transmission. We've learned that squarely, not necessarily in March and April, but really over the past couple of months. The other very important thing, no one knew this early on, that even those who do not have symptoms and look perfectly well are spreading the virus. You've heard about asymptomatic spread. You've heard about people who are pre-symptomatic spreading the virus. This is a very important feature. Unusual feature of a virus makes it harder for us to manage and track. And part of the reasons why we must take early actions, we must take actions that even if the impact is seemingly invisible to some because folks aren't sick who they're around, this fact is a very critical one that pushes us to take these actions now. And then importantly, and this has really been an important guide to me and our team here, clarifying that roughly 12% of today's cases will be hospitalized in the next 2 to 3 weeks. Since early July, we've been tracking this, and although in some parts of the states it's as low as 6 or 7%, other parts it's closer to 15 to 20%. On average, 12% of our cases will be hospitalized in 2 to 3 weeks. What does that tell you? It helps you plan based on what you're dealing with today in hospitals, today's cases, what the next 2 to 3 weeks looks like. And that helps us make decisions now so we can avoid some of those big surges in the hospital beds and the potential for not having the capacity that we've depended on to date. So again, it's always important to emphasize what we can do to make a difference, to keep our schools open, to keep that economy operating as much as possible, and our healthcare system functioning. Talked about wearing that mask, wearing your mask not just when it seems convenient or when it seems like you're around people you don't know, but as much as possible. We've updated our mask guidance, and we will update it again as we continue to evolve with the science and see opportunities to support additional masking across our state. Keeping your distance, spreading things out when you can, using the entirety of your backyard for a gathering, using multiple rooms when you're with someone else indoors, and spreading things out, I think, is really key to helping us reduce transmission. We've talked about the importance of circulation, keeping windows and doors open so outside air can come in and frequently is important. Keeping things short no matter where you're together with others, keeping it small. We've talked about our California standard that no more than 3 households. This includes your own household, so it's not 3 others, it's yourself and 2 others. Important. And now today, underlined here, bolded here, gatherings shouldn't occur between 10 p.m. and 5 a.m. We know that's hard to imagine how to enforce. Some of you may say, well, how am I ever going to be known if I'm doing that at home? We've depended on a partnership with all of you. This is about coming together. This is about us deciding to do some things that sure it's an inconvenience, sure we may not want to for a short period of time so we can get this under control and hopefully bring rates down to a place where counties don't just stay in purple, move to red, orange, and yellow down the road. And it's always important to end these actions with an eye towards protecting older Californians and those at risk. I'll take this opportunity to remind you that even though only about 10% of California's cases are in individuals over the age of 65, 75% of our deaths, that worst outcome that we want to prevent at all costs, is experienced in that age category.